All right. Okay, so hopefully everyone can see. We're going to start at the beginning. So this talk is very near and dear to my heart. I'll share a little later about my own personal mold and mycotoxin story, but we're going to go through bit by bit, as much as we can fit in tonight, talk about mold and mycotoxins and their effect on our health. So this is me. My email information here, it's also at the end. A lot of you have my email contact already, but you're always welcome to follow up and message me. I've got some handouts and questionnaires and stuff that I'll be happy to email to people at the end today. So you can email me, and if you email me, I'll send it all out to everybody. So what exactly are we talking about here? So this is our starting point. We're going to define tonight, in this talk at least, we're going to define mold, mold spores, and mycotoxins so that we're all on the same page. We're going to talk about some myths and truths around mold and mycotoxins. We're going to talk a little, I don't think we can fit it all in, but we're going to talk about the health effects of mold and mycotoxins on the human body. And then a little bit, we're going to touch on the beginnings of the healing from mold and mycotoxin illness, which could and may be an entire talk unto itself at some point in the future. So, to jump right into it, the picture there, you can all recognize mold. It's a type of fungus, so in the same category as mushrooms. Mold can be any color. This picture here, although, is pretty typical of what you all think of as mold. Mold reproduces through microscopic spores. So the spores are basically their seeds that they're sending out in the world, into the world. And when mold is exposed to air, it smells. So when you walk into a place that smells musty, that's because there's mold growing that's exposed to the air, and it's creating volatile organic compounds and aldehydes and alcohols. Those are the things we actually smell. But mold can be trapped, and when it's trapped behind a wall or a ceiling or a floor, it won't have an odor because it's not being exposed to air. So it can be hidden. Mold spores, this is a microscopic image of a mold spore. Mold spores are actually really pretty under microscope. So they are 1 to 20 microns in size, which I know probably doesn't mean a lot, but these numbers are really more to compare to each other. So mold spores are the biggest. Spore fragments are just spores that have been broken up into tiny bits, usually when we clean mold or disrupt it in some way. And both of these can lodge in our sinuses and lungs, but that's as far as they go. They can't get into our bloodstream or deeper into the tissues. They're just too big. But both of these, spores and spore fragments, release mycotoxins, tons and tons of mycotoxins. So what's a mycotoxin? So in this picture of bread mold, which I'm sure you've all seen, if you've ever looked closely, you can see that there's the green dot of mold and then there's a white circle around it. So that circle is a sterile area around the mold, and that sterile area is basically like a moat created by the mycotoxins. The mold releases toxins in order to defend itself and create a safe space, basically, to keep other mold from getting in on its territory. Mycotoxins are essentially mold gas, and they're a defense mechanism, and they're 0.1 microns in size, so much, much, much smaller. They're fat soluble. They get into every cell and tissue in our body because they're so tiny, and our own cells are made of fat, phospholipids, so that's how they're able to get in. They're fat soluble. And unlike mold, when it's exposed to air, mycotoxins are odorless and invisible. So if you have trapped mold behind a wall, the mold spores may be too big to get out into the air that you're breathing, but the mycotoxins are not. They can move through walls, floors, and ceilings. So size matters here, and this is just to put it all on one page so you can see that mold spores are the biggest. There's the actual mold that, if you can see it, is visible. That's very big. And then spore fragments and mycotoxins. So what do all of these things actually do in the human body? We know that mold and spores, the spores can only get into the sinuses and lungs, but what about mycotoxins? So if you read out there, if you start Googling this mold illness or mycotoxin illness, you'll come across a lot of things about mold allergy. So that is what I'm going to refer to as mold illness, where we're really talking about an allergic reaction to spores and spore fragments. So sinuses and lungs that are being irritated by those trapped fragments or spores. So it creates respiratory symptoms, sinus symptoms like sinus infections, asthma, things we typically think of that maybe people with seasonal allergies have. And then, but the important part here, and we'll get back to this in a little while, is that those mold spores that can get trapped in the lungs and sinuses still produce mycotoxins. So even when you're out of the moldy environment, you still could potentially be harboring mold spores in your own body that every time you breathe, you're disturbing them and they release more mycotoxins. So you get these small, constant doses of mycotoxins back into your body. Mold doesn't like to be disturbed, and anytime it is disturbed, it will release toxins in response. And then mycotoxin illness, this is the part that is controversial, not accepted. A lot of people will roll their eyes at you. This affects every system in the body because remember, they're only 0.1 microns in size, so they get everywhere. It's very, very frequently misdiagnosed. Even on my own part, I will say in the last year, I have learned a lot and have gone back to some of my patients. Probably some of you are here tonight and said, hey, I think we need to test you for this. So there are so many different diagnoses that people will come to me with when really the underlying problem is mold exposure and mycotoxins. So mycotoxins can alter genes. They can cause cancer, particularly in the literature, you'll see it as in the liver, affecting the liver. And they can be from past exposure, so it doesn't have to be that you are currently living in a moldy place or working in a moldy office building. It could be from 15 years ago. So I could have just written every system, but I wanted to lay them out here and just show you all of the systems in the body that are affected by mold. And you can kind of think to yourself in your own body and your own symptoms, which areas are affected for you if this is something that you're considering for yourself. So respiratory system, obviously, with the breathing difficulties, sinus symptoms in the ears, eyes, nose, and throat. Circulatory system, we'll get into this a little bit more in a bit, but a lot of things with blood flow, heart rate and rhythm, edema, congestion. Nervous system is a big one, especially the nerves of the eyes and the ears. Digestive system, so many complaints there. Hormonal system, including reproductive system and infertility. Brain, also a big one. I'd say most of my patients have some degree of brain fog, myself included. Urinary system, another big one that often gets overlooked. The kidneys and bladder often get overlooked. And the immune system in all kinds of ways, but a lot of immune suppression and depression and confusion, autoimmune conditions. So how mold actually makes you feel. This first line I stole from Jill Krista, and you're going to hear her name come up a lot tonight because I reference her work and her research and her book. She's wonderful. Crazy, hazy, and lazy. So mold makes you crazy because a lot of people don't believe you, including partners and family members, because everyone else in the house says they feel fine. And you might start to think you yourself are crazy. Hazy because of the brain fog, difficulty thinking, remembering words, forgetting where your keys are all the time. And lazy because every single person I see almost is tired in some way, either morning, afternoon, all the time. Those are really the three big ones. And then these other ones are just things that I commonly hear people say. So dizziness of any kind, just feeling unsteady, to frank vertigo, not being able to walk around, to the degree of where people feel very, very nauseous and dizzy. Achy, there's a lot of body aches and pains, especially neck and head and shoulders, but could be anywhere in the body. Numbness and tingling all over, hands, especially extremities, but hands, feet, legs. I would add to that also electrical zinging sensations anywhere in the body that come and go quickly. Puffy and bloated abdominally, and also a lot of edema and water weight gain in gravity-dependent limbs, especially legs and feet. Sock lines are really thick at the end of the day. Feet don't quite fit in shoes. rings don't fit on your fingers, that kind of stuff, puffy eyes and face. And nausea. Nausea is another really big one that I hear, sometimes with food, sometimes just any time of day, sometimes right on waking in the morning, but a lot of bouts of nausea, and sometimes, less commonly, but sometimes associated with cycles of vomiting that come on for no reason, or no reason that they know of. And then this is just from my own practice, common symptoms that I've heard people complain of. Remember, mold and mycotoxins affect every system in the body. So pretty much any symptom you have, depending on the whole constellation, could be mold related. But these are really common ones. Anxiety, and it's particularly a physical sense of anxiety, not mental worry. So there's this, getting stuck in your head and latching onto a thought and worrying about work or family or the world that we've all been worrying about this year. This is more a physical sensation that often comes on when people lay down to go to sleep is a big one. It could come on any time of day, but especially at night. It can come along with vibratory sensations in the body, feelings of blood rushing or energy rushing into fingers or feet. Heart rate changes. Usually there will be a sense of feeling the heartbeat, even if it's not particularly fast, but that just it's noticeable. Or heart rate can increase for no particular reason. This whole constellation of things I see very commonly. And then, like I mentioned, fatigue, just feeling really, really run down and not able to get through the day and get through the things that they need to do. This is often paired with insomnia, a lot of insomnia, mostly waking up in the night. And I've noticed it's often 4 to 5 in the morning for whatever reason, although it could be any time. Sometimes people also wake up every 2 hours, every 3 hours, but a lot of trouble staying asleep. Brain fog, of course, sometimes that comes and goes and can be worse in the winter time or when people are indoors more. And then every kind of digestive issue that you could imagine. I would say constipation is probably at the top of the list. Sometimes nearly paralytic constipation where there will be multiple days without bowel movements, or any kind of IBS alternating back and forth between diarrhea and constipation. People who tend more toward loose stools, frequent stools, or diarrhea actually have a slightly less congested system, and it's sometimes a good sign. We'll talk about that in a bit. So if mold is everywhere and it produces all this tiny, tiny bits of mycotoxin or mold gas, why isn't everybody sick? Or even in a single household, why isn't the entire family sick? So this is a question I get a lot. Number one, genetic susceptibility. So 25% of the population are mold canaries, people who do not genetically make antibodies to mycotoxins. So your body doesn't recognize that it's a foreign invader, and therefore it can just build up faster. So if you're the only one like that in a household or in a building, you're going to build up levels of mycotoxins in your fat cells much, much faster than anybody else. So your total body burden and exposure over time are just going to be higher. You're going to get more than other people. There's also a female versus male difference. Women tend to have higher body fat naturally, and because mycotoxins are fat soluble, we women tend to build up those toxins at a faster rate. So if a male and female are in the same mold damaged, water damaged building, and they're both sensitive, let's say, the women will still tend to become sicker faster. And then I added over there at the end awareness. I've noticed this a lot lately, more so in men, but in some of my female patients as well, where people are just not aware that they're sick, or they've normalized their symptoms, or they've justified them for some, they say, well, I'm tired because I work too much, or I'm just not managing my stress well, or I've had a lot of stress in my life. We sort of give reasons for why we feel the way we feel. And so sometimes I think it's just not in our awareness that mold might be the cause of what's making us sick. So when we talk about burden, and that women tend to build up burden of toxins and infections faster because of our higher body fat, toxins include all of these things. And it's good to remember because it could get confusing when you're talking about mold and mold spores, and we all know what mold looks like, so we think of it as a living thing, which mold is. It's a fungus, but mycotoxins are a toxin. They're not a living thing. And so like heavy metals, pesticides, and other chemicals, mycotoxins build up in our tissues in just the same way, even worse in a lot of ways. And any toxic buildup, and people often have more than one, tend to clog our detox pathways, which then leads to more buildup. So this little image shows us all the ways that our body detoxes things. And the biggest ones are liver, colon kind of go together because anything bound by bile gets taken out through the large intestine or the colon. That's really the biggest one. And then lymph and kidneys, I would say, are probably the second. Um, but as one gets clogged and then another gets clogged and on down the line, we just become more and more toxic. And at some point, you hit that overload where the toxic bucket becomes too full and the body's no longer able to get rid of those toxins as fast as they're coming in. That's when people start to have really bad symptoms, and that's often when they show up in my office. And there's also infectious burden. So I just want to mention this briefly because every single person so far that I've ever seen with mold illness has more than just that going on. Very commonly, they have gut infections or dysbiosis with yeast, parasites, potentially bacterial overgrowth. And then Lyme disease, co-infections, high viral counts, those can all add to the burden on our immune system and the burden on our detox pathways. And then the combination of those two things, the toxins build up and they clog up our system. They literally make our bile turn gummy and clog up the detox pathways. And infections burden the immune system, especially these stealthy infections like Lyme disease and all of its various co-infections, the viruses. They tend to hide and confuse our immune system. So most people have multiple things going on, and that's part of what I love about my job, is being the sleuth, the investigator. So if you're thinking so far, maybe this sounds like me, maybe this might be what's going on for me, how did this happen? It always happened from exposure to a water-damaged building. If you start to read online, you'll read about mold in foods and that mycotoxin testing is just a reflection of the mold in the food you're eating. It's not true. The levels of mycotoxins built up in your tissues is always from some exposure at some point in your life to a water-damaged building. So the Occupational Safety and Health Association, OSHA, estimates that 1 out of 4 buildings has enough water damage to grow toxic molds that negatively affect human health. 1 out of 4. That's huge. So a few little true and false questions for you to ponder. I already answered the first one. Mycotoxins in my body are from my food. I've had people come back to me after their internet searches and say this, that, well, this is just because I eat a lot of peanut butter, or I eat a lot of corn and drink a lot of coffee. True or false? False. We knew that. It always comes from a water-damaged building, even if it was 15 years ago. And if your fat cells just held on to it and your sinuses still have mold spores, it's still affecting your health. New construction is safe from mold growth. This is one I get asked a lot about too. People say, oh, my house is only 5 years old. We watched it be built from the ground up. It's totally fine, right? False. So if you've ever seen a house being built and it rains, they don't wait for all of those wooden boards to dry out completely before they continue building. So there's always the potential when wood and drywall, which is essentially just paper, are covered up and sealed into these really, really well-sealed, environmentally sound, energy-efficient houses. It's just a petri dish inside for mold. So don't ever rule it out just because your house is new. My house smells fine, so it must be okay. I gave this one away earlier too, but this is another one that people often say, well, I don't smell mold and I don't actually see anything. And I'll ask, well, did the house ever have a water leak before you lived in it? And they say, well, yeah, but it was taken care of. And it was between the bedroom and the bathroom, and their head is right up against that wall and they don't sleep. Well, maybe the pipe was fixed, but the water leak wasn't. So if you can't smell it, it just means it's not being exposed to the air. And it also means that there might not be living mold, but even dry, dormant mold can still release mycotoxins and spore fragments. It doesn't have to be freshly watered and healthy and living. Even dead old dry mold can be a problem. And mold only affects the sinuses and lungs. I get this one a lot. People say, but I don't have any sinus symptoms. Why are you making me do these horrible nasal sprays? Well, because we know mold spores get trapped in the sinuses and sometimes in the lungs. The lungs move air a little bit more effectively. I find it's often more the sinuses, but both. So again, false. We know that mold spores affect the sinuses and lungs, and you can have an allergic type reaction in those areas, but mycotoxins go much, much deeper than that. So what do we do if we think that we've been exposed to mold and we want to find out more, and then we find out we are? What do we do to actually start healing ourselves? So the first thing I would say is get help. Definitely go see a mold literate doctor and do your research. If you really think this is an issue for you, you want to find someone who really understands all those little details and definitions I just explained to you. They really understand the difference between mold and mycotoxins. And although we as doctors are not, I am definitely not a house expert, and I don't know the first thing about home remediation. It is an area that we get asked a lot of questions about, so you want to know that your doctor at least has some knowledge in that area, and they can guide you toward the right people to help you. So ask a lot of questions and just do your research. And then what do you do? And this is something you would talk to your doctor about, but there's always the question of, if you know you've had a mold exposure in your house, maybe you've even found mold in your house and you're in the process of fixing that, do you treat or do you test first? And this one to me really depends on the situation. If someone knows they've been mold exposed, they know they have symptoms associated with mycotoxin illness, I will often just start treating right away and let them save their money for home inspection and remediation. But if we're not sure and things seem like mycotoxins, then I usually start with a mycotoxin test, which is a really simple urine test that tells us the person's total body burden of mycotoxins. And that's an important part. There's 3 different labs right now in the country that do this test, and they're all slightly different. And the one that I've been using most and that I really like from Vibrant Wellness gives you a really good idea of your overall body burden through time. So not just what's going on in your current living situation, but how much is actually stored in your tissues. And I always have people do a little provoking the night before to pull those toxins out of the tissues. So that's often where I start. If people have really severe sinus symptoms, I will occasionally do a nasal swab and culture where you can actually look for bacteria and resistant bacteria and fungus in the sinuses. And sometimes if people are very sensitive in that area, they need more kind of diligent and tough sinus treatment at the beginning. Everyone needs sinus treatment in mold illness, but some people need more. And in those people, I would start with sinus testing and mycotoxin testing. There's a lot of other testing I should mention, just standard blood testing. There's a lot of markers you can look at. There's a lot of other things to test depending on the person's actual symptoms, stool tests, heavy metal tests, a lot of other things. But for just mold, these are the ones I would usually go to. And then how do you decide if you start treatment on yourself or you do the house first? And the answer to that, again, sort of depends on the person. But most of the time it's both. You need to make the person feel a little better right at the beginning. Most mold sick people are pretty sick, and you don't want, I as the doctor don't want people to feel that bad. So you want to support the system, nourish it, make sure there's no more damage being done. And if they know there's mold or they're really suspicious, then yes, put a lot of emphasis on the house. Get an inspection right away, or if you think it might be your office building or some other thing, do as much inspection of those areas because that is a huge part of getting better. Avoidance is the key. So you always want to check out your environments, past and current. And I always go through a timeline with people and ask them really specific questions about when they lived where and when do they remember their symptoms starting and were they worse in that apartment versus this house and where did they grow up? All kinds of annoying questions about housing. But it's really good to set that timeline and get a sense. And often people will say, oh, right, I do remember that suddenly in 2005, when I lived in that moldy apartment in New York, I developed horrible insomnia and no one could figure out why. So those are really good clues because avoidance is the number one most important and most difficult part of healing from mold. Because we all know you can't 100% avoid mold, but it really is non-negotiable to get better. You really have to, and if you're a canary like me and you're very, very sensitive, you have to be extra diligent and extra skeptical about all the things in your life that might be affecting you. You'll never get it down to zero, but you'll get your exposure low enough that you can start to decrease your sensitivity levels and really start to heal. So how do you actually avoid mold? This is a big ongoing question to me, and I've learned so much this year in my own. Some of you know this story, but I moved from Marin to the East Bay in August, but we couldn't find a place to live, so I moved to an Airbnb in August, which was super moldy. Lived with some friends in September. Their house was super moldy. Moved into a house in October that was super moldy, and just moved into a new apartment January 1st. So I can tell you from personal experience how once you realize your own sensitivity level to these things, it can be very challenging to find a place to live, especially if you're not a homeowner, which I'm not. When you're a renter, it's a little extra challenging. So home, car, and work are the three places most of us spend in an enclosed environment most of the time. And yes, your car can be a problem. Most people don't think about that, but if you think about if it's an older car and you get in and out of your car with wet shoes, or you have a really moldy house and you're constantly carrying things from the house in the car to other places, you can contaminate your car and the mycotoxins will bury themselves into the fabric if you have fabric seats and also into the floorboard carpeting. So home is usually the biggest one, especially now during COVID because everyone's at home and working from home. But work can also be a really big one. So I've had patients who are librarians, big moldy place, especially old libraries with basements. Thrift store, people who work in thrift shops, you know that smell when you walk into a thrift store, that's mold. People who do home restoration or historic housing registration, things like that. There are places, and a lot of old office buildings that are really well sealed and super moldy inside. Work can be a big one. But home is probably the place you have the most control over. So inspect them. If you're curious, there are ways to take chunks of fabric or carpeting and send them in for inspection. I can give anyone who's interested handouts on inspection and remediation, the questions that you want to ask those people to make sure you're hiring the right person. And because that's not my realm of expertise, but it is incredibly important. It's expensive. And you want to make sure you're getting people that you trust and who are going to give you all the information and work with you throughout the whole process. And then stuff often gets overlooked. So this is something I learned when I moved into the moldy house in October. We had our stuff in storage, and I moved from Maine. The house I lived in Maine was very moldy. I knew that. The windowsills literally had like furry green mold growing on them. It was terrible. And I brought most of my stuff from Maine, and when we took everything out of storage and opened the boxes, I got horribly sick for about 5 days. And it still took me a minute to put two and two together and realize that all of those things I had been carrying around with me, my sheets, my pillows, my mattress cover, my clothing, was still harboring all of these mycotoxins, and they just like smoke or gas, got erupted as I started rifling through all my clothes. So in addition to moving 4 times, I've also gotten rid of my car and every piece of clothing, my bed, all of my bedding. I didn't get rid of the dog, but I did wash him. So stuff can be a big problem. Anything made out of fabric, furniture, bedding, clothing, you can get out mold spores, but because mycotoxins are fat soluble, they lodge into fabric like pouring oil into flour. If you made a mistake and you try to get the oil out of the flour, it's not going to work very well. And it's the same thing with mycotoxins. I so far have not found anything that reliably pulls mycotoxins out of fabric. So most of the time you just have to get rid of them. Kids' stuffed animals are another big one. Food, so there are moldy foods, and although they don't cause mycotoxin overload in the body, if you already have body burden, foods can add to that burden. And so I have a slide about that coming up, but I'll give you some of the basic foods to avoid. But there is an antifungal diet that I give everybody, and there are a host of specific foods that you want to avoid just to limit the fungal burden that you're intaking through your mouth as you try to control the mycotoxins and mold spores you're breathing from around you. And then these really are for the canaries, especially those really sensitive people. Take a look at your hobbies and travel habits. Once you realize that you are sensitive to mold, I've had quite a few patients who have hobbies that commonly put them into contact with moldy things, like a patient who was a woodworker and really liked to work on old furniture and buy reclaimed wood, just filled with mold spores and had mold sensitivity, or people who love to brew beer or kombucha, antiquers, that kind of stuff. They often are drawn to things that are moldy. So think about what you do for fun. And then travel can become challenging for really sensitive people because many of the buildings that we travel to, Airbnbs, hotels, conferences, they themselves can be moldy. And I had this experience as well driving from Maine to California. There were a couple of hotels we stayed in that I also got very, very sick, and only in retrospect realized what had happened because I just wasn't keyed into it then. So you can see, I think you're starting to see probably there's a lot to think about, a lot of ways that we're exposed, and you really have to think about your own sensitivity and susceptibility. And the other thing that I've noticed as well is sometimes people come in very toxic and sick, and they're not pooping, they're very constipated, they've got a lot of edema, they don't sleep, they're very toxic. And those people often don't notice their sensitivity to mold because they're usually being constantly exposed and their body's not getting rid of any of it. So it's just kind of sitting there in this, heavy, stuck, toxic soup. And as you start to clean that up and you start to get their bowels moving and the edema goes down, and they might have more extreme reactions. Suddenly they take out their winter sweaters and they have this huge reaction, then they get horrible anxiety and they don't sleep for 2 days and they get constipated again. And that is actually a sign that the system is healthier and starting to be able to process toxins better. It sounds a little counterintuitive, but it is actually a good sign. And they might actually get diarrhea from an acute situation rather than constipation, also a good sign that the body's getting rid of things quickly. So I get tons of questions about food, and please, if you have food questions, write them down, let me know at the end. But these are some of the moldiest foods. This is by no means an exhaustive list. There's many more than this, but these are the ones that I think people eat pretty commonly. Oh, I put mushrooms on there twice. I guess it needed to be said twice. Medicinal and culinary mushrooms. Most of these things are moldy because of the way that we harvest or grow them. Peanuts, corn, potatoes, fruits, we tend to pile them up. Some of them grow on the ground like cantaloupes and peanuts, but we stack corn and potatoes in big piles when we harvest them, and then they sit in the weather and they mold. Aged and moldy cheeses, obviously, they're aged through fungus and obviously moldy. Things like coffee, I didn't put on there to make everyone sad, but coffee and chocolate are also moldy foods, but you can find mold-free versions, which is why I did not add it. And then there's also foods that feed fungus. Most people with mold illness have fungal overgrowth in their sinuses and in their gut. And fungus, yeast overgrowth, candida, whatever you want to call it, loves sugar. I didn't put alcohol on here, but I should have included alcohol. So sugar, sweets of any kind, baked goods, dried fruit, fruit juice, simple carbohydrates, including pasta, crackers, that sort of stuff, and yeasted bread. Those are kind of the big ones, and alcohol, that just the favorite food of fungus. So as you're trying to kill it, if you're eating these things, you're just going to be feeding it, and it's going to grow faster than you can kill it off. And I have a bigger, more extensive list if people want it. And then I'm not going to get into the actual treatment of mold. I figured I would save that for a later date. But I did want to give you a bunch of resources. Most of these I took from Jill Krista's website, drkrista.com, except for her YouTube page, which I added. She's got a lot of really great short YouTube videos, 5 minutes, 10 minutes, 12 minutes. They're really great on a lot of different topics. And her book, which is a resource I give out to everyone. It's a really great book for the public. It just explains everything in very simple language, and she has a whole orange model of healing that I do use in my practice, but you can also do it yourself from her book. She gives you the whole guideline of fundamentals, how to protect the body, repair the tissues, and then fight off the fungus. So it's a really, really great resource. Excuse me. And then this Mold Finders Radio is also a really great podcast written by an inspection company that she has worked with. But they have great little short podcasts on a whole lot of different things around mold because it is a very large and confusing topic. So I encourage everyone who thinks that they might have a mold issue or be affected by mold to educate yourself. Really read a lot, learn as much as you can. And then if you really do think you're sick, of course, find a mold literate doctor, but really read about it because there's so much to learn. And we're still constantly learning more about it. And it's really good to educate yourself. And there's so much of mold treatment that is really about you and your environment. So there's a lot of it that people have to do on their own anyways. So it's really good to educate yourself as much as possible. And that is it. Sort of short and sweet for tonight. I just wanted to kind of give you the basics. And I'd be happy to answer questions about treatment, more in depth about treatment. I just didn't want to write it all down in a bunch of slides. So if anyone wants to ask questions, I'm going to go back to the screen. And if anyone would like to ask questions, you can type them in the chat, or you can just unmute yourself and ask.
Hi, Sangeeta.
Hi.
How's it going? Yes, it's me. I'll unvideo myself. Unmute my video.
There we go. Now I can see everybody.
Hi.
Hi.
So I had a question for you. We had mold in our house. We had exactly what you described, like, oh, my house, it's in a sunny area. It's so hot. We couldn't possibly have mold damage. No, I don't smell anything. It's fantastic. No way. And then it turned out it was everywhere. It was totally like our entire house. It was so bad. So we completely remediated the entire house, cleaned every single thing in the house, gave away and threw away most of our belongings, did everything. And so I feel like the remediation part has been really well taken care of. But my question is, the doctor that we're working with, who's a functional medicine guy, is really not doing too much in terms of treatment. It's really like glutathione and Welcall, which is like the prescription drug, and that's it. And we have a far infrared sauna. So that's the entire treatment. And it just feels to me like that can't be enough.
Yeah, so I'm glad you brought this up. And this is part of why, so the protocol for people is, different per person. But the thing that I think a lot of mold doctors focus on is binders. And Welcall and cholestyramine are the two big prescription binders. They are really harsh, and the problem with them is they bind everything. And most people with mold illness are already nutrient depleted. And then you give them something like Welchol or cholestyramine, and it just depletes their nutrients further. And most, or many, I would say, of my mold patients at least, are constipated. And when you're constipated, binders will make that worse as well. So again, this is stolen from Jill Krista, or learned from her. I took her practitioner course. Her big thing is bile moving. So there's two things that I think get missed in a lot of mold treatment protocols for people. The doctors aren't tough enough about stuff and really good housing inspection. They're like, yeah, get your house inspected, get it cleaned, but they're not really adamant about, no, you need to do testing before and after, and you need to hire, the proper people and make sure it's done right. So it sounds like you did that part, which is great. So there's that piece. There's also no emphasis on sinuses. And as far as I know, Jill Christ is the only one that's really pushing this, and it's kind of her own, something she's learned from her own clinical practice, that because mold spores get trapped in the sinuses, they can stay there indefinitely. And like I said at the beginning, mold is very, very territorial. And it will go into a new space like your sinuses, and it'll start spewing out mycotoxins in order to clear the perimeter. Well, that makes your natural fungal colonies, because even healthy people have fungus in their sinuses naturally, your normal, happy, calm, content fungal colonies also get angry and start to fight back. So they start lobbing mycotoxins at each other. So you've turned your own fungal colonies into angry bad guys that are fighting the mold spores. And every time you breathe, especially when you breathe heavily, you bother them and they release more mycotoxins. So her recommendation, and what I tell my patients, is nasal sprays twice a day, every day, for 6 months minimum, and a lot of focus on gut antifungals, bile movers, detoxification support. Bile gets gummed up in mycotoxin illness. So that's a part of what causes constipation. But people can actually also end up with gallbladder sludge and stones. Normally our gallbladder should be, or our bile should be, like olive oil at room temperature, pour nice and smooth and help emulsify the fats. But in mold illness, it's more like butter. It's all chunky and maybe a little soft at room temperature, but thick. And so you need to get the bile, the gallbladder, really contracting regularly and producing good bile flow. That binds toxins, because bile is our natural binder, and it also promotes regular bowel movements. So bile, bile, bile. More bile. And binders, I don't actually use binders as much anymore. I often tell people, do binders as needed. So when we're doing other treatments, if they're having die-off symptoms, like suddenly they get a big flare-up of insomnia, anxiety, headaches, body aches and pains, any of those things, that means we're creating a toxic overload in the body. And the die-off is faster than the body can detox it. And so that's a great time to use binders, is to soak up all those extra toxins that the body's having a hard time processing and pull them out through the bowels. And if people are having regular bowel movements, binders are probably not a big issue, but I would do something gentler that's not going to bind your good minerals, and not do them, rotate them around and not do them all the time. So,
and when you mention the nasal sprays, is that like nystatin, or is it like just a basic antifungal like that?
I don't even typically tend to do prescription nasal sprays unless people have, like, sinuses are their big area. If people come in with their main complaint of just chronic sinusitis and they're constantly on antibiotics, then yes, I would probably do a combo. So I always do 2 nasal sprays. And I'm sure some of my patients in this group right now are laughing because they're doing this. So one of them is a biofilm disrupting nasal spray, and the common one, you can just get at any old drugstore, is called Xlear, Xlear.
Yeah.
Xylitol, saline, and a little bit of grapefruit seed. So that basically goes in and clears out all the biofilms that the mold spores and fungal colonies hide behind. So the longer any colony of anything, bacteria or fungus, has been there, it creates thicker and thicker walls around itself for protection. Dr. Paul Anderson describes them as a little pup tent when they're young, and then if they've been there a long time, it's like a skyscraper. So you have to use like a soap, basically, that washes away those biofilms over time so that the other medicine, the second nasal spray, the antifungal one, can actually get to them to kill them. And I often use hydrolyzed silver sprays with herb combos. If people aren't sensitive to alcohol or aldehydes, or their sinuses aren't already really inflamed, you can also just take the X-Clear nasal spray and add a few drops of essential oil. And there's a whole list of mold oils like tea tree, clove, oregano, thyme, rosemary, those sorts of things. I can't personally do that. It really hurts my sinuses. But people who can handle it, that's a great way to get both things in at once. You get the biofilm and the antifungal, and you do 2 sprays per nostril twice a day, morning and night, for a minimum of 6 months, along with internal antifungals. So when your sinuses become angry, your fungal colonies, you end up with a predominantly fungal microbiome in your sinuses. That same exact thing happens in your gut. So I think every single mold patient I have also has yeast overgrowth, candida. I call it fungal overgrowth because there's more than just candida in there. But the same thing happens. The mycotoxins kind of irritate your native yeast. It gets angry, and you have to clean out that angry yeast so that the old, calm, happy, content, compatible fungus can be there. Because candida is a normal part of our flora, but you want it to be calm and cohabitate with the bacteria and leave room for the good bacteria to thrive. So those are kind of the big cruxes of how I do it is different for each person, but nasal sprays, internal antifungals, all of the different detox support things that Jill Krista outlines in her book, and there's a lot of them, but you basically want to make sure all of your detox pathways are open. Kidneys and bladder are often very affected with mold, but they get kind of ignored. So I try to support the detox pathways in people that seem to be affected. And everybody's a little different, but almost everyone needs some liver, gallbladder, and digestive support.
I'm sorry. Thank you so much. This has been so amazing. Can I ask you, in terms of the bladder, um,
Mm-hmm.
what kind of issues can it, because I have a friend who suffers with an inflamed bladder.
Yeah. So that's exactly it, actually. A lot of times people will come with the diagnosis of interstitial cystitis, which is an irritation or ulceration of the bladder lining. And the symptoms can feel like an acute urinary tract infection without the infection. So urgency, frequency, feeling like you have to pee all the time. The symptoms you would expect of a bladder infection, but without the infection, are common with mold because some of the mycotoxins are detoxed through the bladder, and so as the urine sits in the bladder just in a normal way, not like you're holding it for hours, but just in a normal way, they irritate the bladder lining. So especially at night, I've noticed this. Women will say, suddenly for no reason, I'm getting up to pee. It's like I'm 75. I'm like getting up to pee all the time at night, and I feel like I still have to pee more, but I can't. Or I go to pee and only a little bit comes out. Like all kinds of different bladder issues like that. And then in some people, especially in acute exposure, I've seen them complain, or I've heard them complain of kidney pain. So kind of, upper mid back. They'll say that where their kidneys are, which are kind of right behind your ribs, the lower part of the ribs, feels burning or heavy. And it will scare them, and they'll think that they have a kidney infection. And again, that's just the toxins are very, very irritating to the tissues. But any changes in urination are a sign.
And is there a remedy for that? Because she has been on steroids, she has been on antibiotics. It helps for
Mhm.
a while, then it comes back. She has these terrible flare-ups during intimacy. It's painful. She's bloated. She has to like wear her pants. She can't have the skin is tender, around her abdominal area, around her waist. So is
Mhm.
there a remedy?
Yeah, everything we've been talking about. So this is exactly, this is a really good example. So thank you for bringing it up of people who come to me with like, let's say a condition like this, and they've been diagnosed with something or not, like no one can figure out what's wrong with them. And so having been on steroids for a period of time is usually a sign that nobody knows what's going on with you. So let's just take the inflammation away with steroids because we don't know what's causing it. That to me is a sign that something's being missed. There's something in there, either infection or toxin or both. And it's not necessarily just the bladder and kidneys. That's where she's feeling symptoms, but she probably has some sort of gut dysbiosis, some sort of, imbalance in the gut. There could be other things going on in the body. It's very rare to find someone who only has one symptom in one system of the body, especially when it's that severe. So that's the exact situation where you want to find someone who's going to run the appropriate tests and do a wider search. Don't get so narrowly focused on just the bladder and kidneys, but think bigger and wider and think of what could be causing, what on a deeper level could be causing that continual inflammation. I mean, I would guess it might be mold, but in that case, she would need to get herself tested, potentially test her house, the whole gamut. Unfortunately, no quick and easy fix.
Thank you so much. She is on. She said she's trying to unmute, but she's having difficulty.
You know what? I got it unmuted.
Oh, great.
Go ahead.
I'm here. So I wanted to ask you, what type of antifungals do you recommend? Do you recommend like the ones that you get from your doctor, or do you recommend natural ones?
Both. It depends on the person. So if people have, I personally, in most of my patients, for internal antifungals, and I'm talking about things that are treating the gut directly, I tend to use prescription-wise, I use nystatin a fair amount, but I always pair it with some sort of antifungal herb, and there's a whole host of good ones. So nystatin is an internal antifungal. It's not systemically absorbed into your bloodstream, so it treats the gut locally without going into other tissues, which has pros and cons. Most of the time I'm trying to treat the gut more directly, and I don't want the systemic effect. So nystatin is well tolerated at high dose. People can take it for long periods of time. I've only had a couple people ever react to it poorly, and I think it was more because they had such strong fungal overgrowth that the die-off was really severe. It wasn't the drug, it was the die-off. So I will often use that paired with some combination of caprylic acid, undasolinic acid, berberine, oregano, olive leaf, tulsi. That's the thyme. Those are the ones I can think of off the top of my head. There's a lot of combination products out there that I use that are combinations of volatile oils and other things, and I rotate them around. I typically have people on antifungals for 3 to 6 months, depending on the level of severity, along with the nasal sprays, and it's good to rotate them so that you get a nice broad spectrum approach. Now, if people have toenail fungus.
Oh, I have that. That's one thing that just all of a sudden spurred up my toe, just all of a sudden had fungus all over it.
So toenail fungus is almost always a sign of fungal overgrowth in the body in general, including gut. So I would treat both. But in the case of toenail fungus, I do sometimes use the azole drugs. I prefer itraconazole. It's a little bit more well tolerated, but there's ketoconazole, fluconazole, which everyone knows, that's diflucan.
Yes,
I will use those occasionally, but after I've prepped the person and made sure that their detox pathways are really open, their liver is really well supported. The azole drugs are known to inflame and irritate the liver, which isn't necessarily horrible. The liver is amazingly resilient and can get past it. But if this person is sensitive to that and they have a sensitive liver, it can be uncomfortable and cause a lot of side effects. So I don't use them often, but I will, in certain cases, use some of the azole drugs.
Okay, thank you so much.
You're welcome.
Really good information. Thank you. I appreciate it.
Mm-hmm. Anyone else?
Hi, Dr. P. It's Laura Freundlich here. I don't have my
Hi.
on. Wait, maybe I can start my video. Okay.
Hi. There you
are. So
Florida.
For everyone else who's listening, I'm currently being treated for this. So Based on what you said, it seems like for those of us, I guess, who are in the 25% who tend to be sensitive, this should be an ongoing check, like as just part of our health profile. Like if I'm going to do baseline blood work every so often, it seems like I should also get a mold and fungus check, even after I go through this whole, hopefully, get rid of all the mold that I have now. Is that correct? And if so, how often should that be done?
So retesting is also something I don't necessarily do as a matter of course. Some people really like the numbers, some people just like test results, and that's cool. I like test results, and I'm happy to do it. And especially during the first 6 to 12 months of treatment, it is good, especially with mycotoxin testing. And if there's home inspection and remediation involved, it is good to run a baseline and then do a follow-up to make sure all those mycotoxin numbers are dropping. And if they aren't, or if there's one that just seems really stuck, that gives you a clue that maybe you're still being exposed via your stuff. Maybe there's some hidden exposure from your car. It makes us think, okay, let's really do a fine check of things and make sure there's not some hidden exposure we haven't found. For sensitive folks, I think the biggest key is minimizing their exposure pretty much forever, but it's the first bit of treatment. And if they're really bogged down and really sick when they start, it may take a year. I'd say 6 months for most of the average people I see. But for really sick patients, getting over, people with horrible chemical sensitivities and they can't get out of bed and just really, really sick, I would say a baseline of a year to really get kind of back to normal. And then from that normal point, from kind of their baseline, they will at that point be aware of their symptoms. So this is a big piece. You want to know what your symptoms are. Like for me, I know now after my last 6 months of experience that an acute exposure causes that incredible physical anxiety where I feel like I'm crawling out of my skin. I don't sleep at all for about 3 days. I now tend to get more diarrhea, whereas before I would be really constipated. So it's a good sign. My body's actually getting better. And now it takes me about 3 days to really get past an acute exposure. And in the past, it would take much, much longer. So I think it's really good to start to tune in to what happens to you with an exposure so that you know right away. And you have your little toolkit of what to do in those moments to halt the progression and speed along the pushing out of toxins. That to me is more important for the canaries in the long run. And to take, certain supplements here and there to support the systems in their body that are weaker. And everyone has different weak spots. So if it's your sinuses, you always want to be aware of that. And the minute things start to go out of balance, go to your toolkit and do the thing that helps. And continually support the parts of your body that maybe struggle a little more. Like if you always tend a little toward constipation, really keep up with supporting your liver and gallbladder. Make sure that you're getting good bile flow and regular bowel movement. So knowing your body and really tuning into your own sensitivities is going to help the canaries a lot in the long run.
Okay, thank you.
Yeah.
Hi.
Hi.
My name is Renata. I have a question. I'm friends with Karen. So she actually sold me the house that we just bought recently.
Yes. Karen also gave me one of the inspectors' names that's on my list of people that I give out. So thanks, Karen.
Yeah, she knows everybody.
Yeah.
So I have a question for you. So the mold exposure just activated my mast cell. I have mast cell disease.
Mm-hmm.
And when I was exposed to mold, I was having anaphylactic shocks and I was hospitalized because it was closing my breathing. So in a situation like that, that's just more extreme, I have noticed that it can be challenging for me to use the botanicals because the botanicals, sometimes they have fillers, and people with my disease, they can be very reactive to fillers. Mm-hmm. So is it safe can you recover just with medications alone, prescriptions, or is the combination of both the best?
I think the combination is the best, but what I will say is sometimes when people attribute, so when people have MCAS or SIRS, these hyperreactivity histamine reactions, that is a very classic sign of mycotoxin illness. And it just means that that is how your body is responding. And it is a little harder to treat, you're right, but there are some tricks that you can do that I've used with my really sensitive patients, like nebulized or inhaled glutathione rather than doing oral. Inhaled and oral cromolyn sodium, which is a prescription medication. The oral one is a really great way to stabilize mast cells if there's food sensitivities. Pretty hefty doses of quercetin regularly. So there are some things you can do to moderate that histamine response. But what I've really found work best in people with that really strong histamine reaction is the sinus and gut treatment together, which often doesn't get done long enough, will take down the load enough that you will no longer be sensitive to herbs. Because they do, a lot of them have salicylates in them, which can aggravate people with MCAS and with SIRS. It's true, but I have had plenty of patients that get over that. You just have to start more gently and do things one at a time. So with really sensitive people, I will do single herbs, only olive leaf, and see how you do, and low dose. I give really high doses of things over long periods of time, higher than most people, I think. It's often 2 capsules of things twice a day or 3 times a day, I mean. But with a sensitive person, you just start lower and you titrate up, and then you add a second thing so that you can watch for reactions. And really being diligent about diet too. Oh, the other thing I didn't mention is fat. So fats are incredibly important, and this speaks to the MCAS and histamine question too, because food is often can be a trigger, histamine high foods. Fats are really important to detox mycotoxins because they're fat soluble. You want to dilute them in fat and pull them out through the bile, gallbladder, large intestine. So copious clean fats, and if people are having and most like EPA DHA is also anti-inflammatory, so it's going to help calm those histamine reactions. And if there's brain involvement, like brain fog or anything, you want to have higher DHA than EPA. But high dose fish oil or high dose DHA oil is another thing you can do to help calm those reactions. You basically have to find things that help calm and mitigate the histamine response so that you can work through it. And medications can be useful. Like I used to be very against Flonase. I would just take everybody off of Flonase. And then I realized that so many people's sinuses were so incredibly inflamed that if you tried to even give them a saline nasal spray, it burned. And so Flonase, even though it's a steroid, can calm that localized inflammation enough that the medicine can get in. And then over time, you just decrease the Flonase and eventually people are able to stop. And it's kind of the same with other prescription medications. You use them as supports until you don't need them anymore.
Yeah, thank you so much. Appreciate it.
Yeah. It is tougher, I will say. People who have really strong histamine reactions, it is a very tough situation, and it is slower and can be challenging to work with, but it is possible to stop those reactions.
Yeah, because I can only take one thing. It's one medication or one supplement a month at its best. So I think this is probably gonna take 10 years for it to.
Well, another reason that that happens is it's often that people's detox pathways are not as open as they could be. So, again, lymph flow, blood circulation, lungs, skin, colon, kidneys, you want to make sure they're all as open and functional as possible, because if the body can't detox things well, you're going to have stronger reactions. You're going to feel worse. And that goes for die-off and also for exposure. So that's one thing I think that often gets glossed over in treatment sometimes, or just not even glossed over, just maybe not completely thoroughly talked about, is really looking at each person's individual presentation of how well is this person really detoxing. and then doing whatever you can to get all of that really open, and doing that before you really try to treat. Because if you try to go in and kill fungus in the sinuses or the gut, and those pathways and that foundation isn't set, most people will feel worse. Mm-hmm. So if someone's really sensitive, there's more preparatory work you need to do before you can dive into the treatment phase.
Makes sense. Thank you.
Mm-hmm.
I have a question.
Yeah.
Do you do telemed? I'm in the East Coast, so I know you're in California.
Yeah, we do. I think that's the name of things these days. Because California just came out of sort of like one step from the shelter in place. Like I noticed the hair salon opened today. So we're still very much on cautious moving about in the state. So I think most people are, myself included, doing primarily telemedicine.
Okay.
Yeah.
Okay. Okay. Thank you.
Uh-huh. Yeah, like Laura used to live here, but so we've seen her before. She lives in Florida now. So they're definitely.
One other question I did want to ask you, are dark circles under one's eye another sign perhaps of fungus or mold?
Those are called allergic shiners. It's an allergy thing. It could also be an adrenal thing.
Okay.
But it's definitely a sign in general. The specifics would, depend on your individual case. But when I see dark circles, I definitely think depletion in general, probably not sleeping well, probably some hormonal disruption, and probably some allergies, food allergies and or environmental allergies, which would include mold.
Okay. Thank you.
Mm-hmm. Anyone else? All right, I think that's everybody's questions. Well, thank you, everyone. This ended up being I'm glad we had this. I'm glad we had all this time at the end for good discussion and questions and answers, because I feel like this is the meat of it. This is the fun part.
This was great.
Thank
Absolutely
you very much.
amazing.
Thank you very much.
Yeah.
Thank you.
Yeah, you're all very welcome. And also Alexis, who's here right now. Alexis and I did a series of talks together in the fall. And for those of you who are interested in or love homeopathy like me, you're doing an open house tomorrow night, right, Alexis? A virtual open house?
I am. Thank you very much for noticing that. I'm not presenting myself very professionally right now, but in the dark in my living room. But
hey, everyone gets to be patient too.
Yes, Sangeeta and I are colleagues, and I'm having an open house. If anybody wants to join, just I don't know, you could put it in the chat.
Yeah, I can send you the info, but yeah, we have some patients in common, and we've done some talks together, and homeopathy is a great adjunct to all of this. So it was my first love. It's still one of my big loves.
And your last love.
Yes, it will be till the end.
Are there, hi, it's Laura. Hi. Are there any homeopathic remedies that are specifically indicated for this kind of?
For mold? No. I mean, not maybe in an acute sense there might be. I'm not that skilled, but most people with mold illness have very complex cases because they tend to have symptoms in every system of the body. And I think homeopathy can definitely help in those situations. I find people tend to respond at least to like a chronic or constitutional remedy better when their systems are a little less toxically burdened. Like if someone's just got a lot of toxins happening, it can be hard to respond to anything. Like with the histamines, if your body's so overreactive. But homeopathy can help take that stuff down too, when people are being super overreactive to things. So they work really well together.
Okay.
All right, everyone. Was there one other question? Yeah, Tiffany?
Yeah. Can you share your notes with us or your PowerPoint? I was taking notes, but I didn't write them all down.
Yeah, I can share the slides. I'm also recording this, so I'm gonna
Okay.
I'm gonna save the recording and it'll be posted on our website, but I will send out an email to everyone. I didn't have everybody who's on tonight on the original email that I sent the Zoom link out to. So why don't you just email me, send me an
Okay.
email and just say, could you send me the slides? And I'll make sure to send you the recording link and the PowerPoint slides.
Right. Okay. Yep. I'll see you soon.
Okay. See you soon.
Thank you.
Bye.
Yeah. Bye,
Thank you.
everyone.
Thank you so much. Good night, everyone.